Hi, my name's Ian Hall. I'm a psychiatrist working with people with learning disability in East London. So I work in all sorts of different community settings, see a lot of people with autism, and I have to really enjoy my job. I'm also the chief examiner at the Royal College of Psychiatrists. So what does pride mean to me personally? Well, it just means being proud of who you are. And in terms of my personal experience, I've really moved from a position of being ashamed of who I was, being belittled, being discriminated against, both in my personal life and my professional life, really now to one of being proud of who I am and valuing myself for who I am and valuing my identity. I think that experience, though, was one of the things that attracted me to working with people with, firstly, mental health problems and also people with learning disability, because I think there's no doubt that people in those groups are quite marginalised in society, certainly used to be, and certainly used to experience a lot of discrimination. And I think in learning disability services, certainly, there's been a big tradition in the last 20 years of valuing people for who they are, and that sort of approach, being open, receptive to people, being non-judgmental, helps us with all our patients. I think we can learn a lot from our patients too. I was really struck when we had a trust-run conference last year. One of our day centres ran a workshop about pride and how they'd done pride celebrations at the day service, and they just modelled for all the staff attending how good it was to celebrate people's culture and to tell people how much they mean to us. During the lockdown, I'm not sure how we're going to celebrate Pride. I'm sure we'll come up with something. But I was really struck when East London Trust, who I work for, decided to have a float on the Pride parade in London a couple of years ago. And I was quite sort of cynical about this and ambivalent about getting involved because, I just sort of regard it as quite a personal thing. But anyway, one thing led to another, and I did become involved, and I was involved with designing the T-shirts and going on the float and everything. And I have to say, I was astounded by the reception that the float got. People cheering for the NHS and cheering for us and all that. And I went away thinking, first of all, if this is going to encourage LGBT people to come and work for East London, then that's a great thing. But I think more importantly, it's going to encourage LGBT people to use our services, and that's going to be really helpful for their mental health and the mental health of the population. So I felt that was a really, really good outcome.